Hi, my name is Sonya Baker, and I am here today to discuss my project, Walking Away from Depression. Depression in older adults is a common chronic medical problem. Older adults may experience limitations in their daily routines that cause mental distress. Caregiving, loss of loved ones, physical impairments, and changes in living situations are some of the causes that contribute to depression in older adults. The Centers for Disease Control, the CDC, has issued a call to action to address depression in older adults. Healthy People 2020 sets forth objectives to improve the diagnosis and treatment of mental health and mental health disorders. The Behavior Risk Factor Surveillance System is a survey that's administered to individuals in all states to determine various information. But in North Carolina, this 2015 Behavior Risk Factor Surveillance System survey showed that anywhere between 13.8% and 29.3% of older adults in North Carolina have a lifelong depression diagnosis. So that's a lifelong depression diagnosis. That doesn't include other factors such as situational depression, late onset depression, etc. So that 13.8 to 29.3% number, as high as it is most probable actually higher. So another problem in 2015, 15% of the North Carolina population was 65 years old at that point. By 2025, though, 20% of the population in North Carolina is expected to be age 65 or older. So this problem is going to be growing. So we need to address it and consider alternative treatment options to treat these older adults that suffer from depression. So what our plan is to implement an exercise-based program through a primary care setting in Lewisburg, North Carolina at Advanced Community Health Center. It's a local medical center that assists many older adults in the area and provides some free care and screening services. Great place. So we're going to recruit patients 65 years old at Advanced Community Health in Lewisburg. And we're going to screen for those folks to determine who's 65 and older and ask for their participation in this project. So the project consists of a program, an exercise-based program that includes walking for 30 minutes 3 times a week over a period of 12 weeks. Logging these walks into a notebook, into a journal, like when you went walking, how long you walked, where did you do it. At baseline, prior to implementation of the exercise program, we're going to administer the GES-15, which is actually the Geriatric Depression Scale. It's a scale that screens for depression in older adults. So what we're going to do is screen for depression at baseline, and then 4 weeks, 8 weeks, and 12 weeks to see if this exercise-based implementation, this walking program, decreases their depressive symptoms. So at the conclusion of the 12 weeks, data from the walking log and the GES-15 will be compiled and analyzed to determine whether there is a positive correlation between increased physical activity and decreased depressive symptoms. Several studies were reviewed in anticipation of performing this project. I want to discuss those briefly. I reviewed 4 different studies. I had 3 level 2 studies that were included in my analysis, 1 level 3 study, and I also evaluated 1 level 1 meta-analysis. In study 1, Taps et al. Found that a resistance-based physical activity was an effective intervention in lowering the reported levels of depression in older adults over a 12-week period. In my study number 2, Patel et al. Found a decrease in depressive symptoms and an increase in perceived mental health functioning after implementation of an exercise program over a 12-week period. And study number 3, Bernard et al. Found that a 6-month, 3-session per week, moderate intensity walking intervention with a minimal 50% adherence rate reduced depression in postmenopausal women who are at risk for depression. And finally, my last study, Yang et al. Showed that a 12-week virtual reality exercise program lowered depressive symptoms in older adults. And then I also looked at a meta-analysis that reviewed 41 studies that also supported the notion that evidence or that exercise-based programs can lessen depression in older adults. So all of these studies had good evidence with consistent results. My purpose was to try to find an intervention that was a low-cost intervention. Since so many people in my area, it's a rural area, it's a low socioeconomic area, it's primarily farming. So we want to provide these folks with an opportunity to exercise without the excessive cost. This is not a rich area by any means, so we want to take that into account when we implement our program. And we want to give them the best result possible for the least amount of money, so that that's an impetus to participate. But our objective is to answer the question, in older adults with depression, how does physical activity affect depressive symptoms within 3 months? So the purpose was to provide a structured exercise regimen with the goal of reducing depressive symptoms through the promotion of this walking 3 times a week for 30 minutes each walk. The implications of this are huge. Physical activity has been shown to lessen the symptoms of depression, which has been supported by all of the literature that I've included in my presentation. Research shows the implementation of an exercise regimen in older adults reduces depressive symptoms. To properly treat depression, though, primary care providers must first screen for it. So recommendations from Healthy People 2020 suggest that providers screen for depressive symptoms at every outpatient visit to a primary care provider so that you can provide appropriate follow-up. That upon a positive screening for depression, care plans and goals should be established with the patient. In this instance, in this project, the initiation of a physical activity regimen could prove to be an effective treatment for depression in older adults and should be considered as an alternative or an adjunct to standard therapeutic interventions such as medications and counseling. With polypharmacy being a huge issue in older adults, the use of exercise as a therapeutic intervention may be a viable alternative to medications. So we will take this data, compile the information obtained from the walking logs to determine the amount of minutes each participant walked, log that data into an Excel worksheet, include the outcomes from our GDS-15 screenings, and do an ANOVA analysis, statistical analysis, to determine if there's a correlation, if we see a correlation, a positive correlation between the increased number of minutes that our participants walk each week with a lower depressive score on the GDS-15. So we look forward to this project, and I appreciate your time and consideration. Thank you.